welcome everyone. New York Therapy Animals is a nonprofit organization that is dedicated to bringing animal resources to human needs in healthcare facilities through the help of a registered and insured therapy animal team. Their interactive community programs serve people of all ages in various socioeconomic situations. Their work has helped transform lives through their support services run by their volunteer advocates and their therapy animals. We're so happy to have you here. Welcome to all of you.
Thank you. Thanks for having us here. I'm Nancy George Michelson. I'm Executive Director of New York Therapy Animals. And this is my teammate. This is Melody. She's my dog. And tell us who you are.
Margaret, and this is Milo.
I'm Craig. This is Olive Oil.
I'm Beth, and this is April.
So, do you all have animals? All of you? Some of you?
Yes.
Some of you have animals. What do you have?
I have 2 cats.
2 cats. How about you? No?
I have a cat.
Do you have a cat? And Margaret, how many cats do you have?
We have 3 cats, and then he has a brother at home as well.
Hello.
So more dogs and cats than people.
So, I'm just going to talk to you a little bit about a historical perspective about animal-assisted interactions. We don't really call it pet therapy anymore. It's kind of an old-fashioned terminology. We call it animal-assisted interactions, and they've been a long part of programs to help people from way back to the early Greeks when they gave horseback rides to raise spirits of persons who were incurably ill. During the 17th century, the medical literature contains occasional references to horseback riding as beneficial for neurological disorders, gout, and low morale. So in Florence Nightingale in 1859 wrote, "A small pet is often an excellent companion for the sick and for long chronic cases especially." In 1940, at the Paulding, New York Convalescent Hospital, the American Red Cross and the Army Air Corps set up a program for recuperating veterans, which involved association with a wide variety of animals in a farm situation. But it wasn't, I'm not going to read all the entire time I'm here, this is just statistics. But it wasn't until the publication of Dr. Boris Levinson, who wrote Pet-Oriented Child Psychotherapy in 1969, that anyone made a serious plea for careful investigation of the healing power of association with animals based on extensive records of his experiences in his own practice. Dr. Levinson was a psychologist. He theorized that permitting emotionally disturbed children, having them care for pets, had a therapeutic benefit during therapy sessions with his own dog, Jingles. So the idea that human interactions with companion animals can result in physiological changes and psychological benefits, and it's gained a much wider acceptance in many years, especially now, because we have a therapy animal organization that serves many different populations in New York City, the boroughs, and in Westchester. And a therapy dog is an animal. These are all our animals that are pets, that we have seen their disposition that is very calming. They have become very good listeners with their parents, their human ends of the leash, and they have all gone to school to learn how to become a therapy dog team, because these are our teammates. I can't do it without Melody, and she can't do it without me. So we all went to school. It's a 7-week program in Manhattan for people with pets. We have all dogs right now. We used to have a therapy cat in Brooklyn, but he retired. Marvin retired. So we have over 153 therapy dog teams in our program. They have all gone to 7 weeks of school, hands-on classes, and we have a human workshop where we talk about policies and procedures, infection control, the HIPAA law, all the things behind the scenes of what it takes to become a therapy dog team. Then we all had to take a test, an evaluation, and that involves dogs that know how to be good listeners and know their commands, their skills of what are some of the skills.
Well, Al could sit and she could, respond and provide comfort and support.
Right,
You
so
know.
sit down, what else?
Stay.
Stay,
Leave it.
leave it, wait, or leave it. They have to be able to walk around medical equipment and feel comfortable. They have
Loud
to be
noises.
loud noises. And it's the human end of the leash also is being tested to see how they are going to interact with different types of people, different populations. Our teams volunteer in hospitals, nursing homes, children's facilities. The Ronald McDonald House is where that's my other dog. Melody and I go to the Ronald McDonald House, right? We also have a program that we've partnered with the Department of Education called READ, Reading Education Assistance Dogs. And this is a program that we have in schools to help children who are struggling readers. They
And
read-
libraries.
And the libraries, right. And they read to the therapy dogs. Yes, I know, it's adorable. You can go on our website, NewYorkTherapyAnimals.org. You can see a video that we did for PBS for therapy dogs that were working with children with special needs. This is really an amazing program, and we're seeing great results from it. We're receiving testimonials as well as quantitative and qualitative data. So it's a program that started in 1999 at our headquarters in Salt Lake City. We are an affiliate of an organization called Intermountain Therapy Animals, located in Salt Lake City. They started in 1993, and they are a fantastic organization with an amazing staff and very, very understanding and helpful to us here in New York City. So we're really proud to be an affiliate of theirs. But they started the READ program just as a pilot program in one of the libraries to see how it was going to work with children reading to dogs, and it ended up in the Wall Street Journal and a lot of press about it. So we are following in their footsteps. Can you sit down a minute, please? Sit, there you go, sit, and so we have the program in many schools, and we have also partnered with the New York Public Library and the Brooklyn Library for this program. And I'm going to let all of our teams talk to you a little bit about what they do, especially Beth, who's been a team with us for many years. So, do you feel calm? Do you feel pretty good right now? Yes. Why do you think so? I mean, with the dogs in the room, what do you think that they offer to you? Are they perhaps maybe peaceful? Right. They're actually lowering your blood pressure when you're with a therapy dog, when you're petting a dog. They are, your heart rate is decreasing. Your stress levels are lowering. Your breathing slows down, and it's just an overall feeling of relaxation. Don't you feel kind of relaxed and enjoying this? So we're finding that when a therapy dog is in a therapeutic modality, such as a hospital or a nursing home, there are fewer requests for medication when the therapy dog comes to visit. My older dog and I volunteered at Mary Manning Walsh for 9 years, and they would wait for us at the front door to come in. And Wednesday at 2 o'clock, if I was 2 minutes late, they were like, "Oh, I thought you got run over by a bus." I mean, they were really, really engaged in what we do, and this is a commitment. Everybody has to go to school, they have to pass the evaluation test, and they have to want to volunteer somewhere where it's going to make a difference. Otherwise, what's the point? There are, I also wanted to tell you that it also will, it brings out the super bonding hormone called oxytocin, which is like a miracle drug. So being around a therapy dog, this is such a nice opportunity just to gather with you. And we thank Danielle for inviting us. She put all of this together. It's just a nice way for us to share what we do. And we are all very happy with the idea. Truthfully, for me, it was life-changing. I want people to feel like I do with my therapy dog, and it could bring tears to my eyes. But I've been affected by cancer in my life, not personally, but I lost a sister to breast cancer. My father had leukemia. And so this was really a special opportunity for us to come and sit and be with you today.
Nancy, you also missed one other point about lowering stress.
Okay,
We have lowered the stress in the dogs. If you notice, the positions of all the dogs.
that's right.
Fall asleep.
Very true. So I'm gonna let everybody talk, but I just want to tell you something really important. There's 3 types of support animals. There's a service animal, there's emotional support animals, and there are therapy dogs, okay? So none of ours are service dogs or emotional support dogs. A service dog is a dog that performs a task for that person with a disability, okay? It's for that person. It's not a pet. You're not allowed to pet it. It's for that person for whatever reason. An emotional support dog is a dog that is for that particular person who needs comfort in a stressful situation and has high anxiety for whatever the reasoning. And it does require documentation. A lot of people really are abusing that privilege. They are going on the website and they are buying the documentation by a veterinarian is supposedly signing a piece of paper.
I seen it on television that people were doing that.
It is.
They're
and
they're buying the vest.
They're buying the vest.
Service dog vest.
It
and
is
emotional
really a
support.
disgrace because it's cheating and it's against the law. And it's not fair to people who do have disabilities that need to use public transportation, and to have a dog flying next to them on an airplane or going into a restaurant or whatever it is, you know. So a therapy dog is none of that. We're an organization. A therapy dog is an animal that goes out to help others. And that's just what we're doing here, is to be with you and to enjoy your company. So I thought that was really important to let you know that distinction. So what are the benefits of animal-assisted interaction? So it can be for occupational, physical therapy, and psychotherapy. So we have, our teams have worked with psychotherapists for children who are terrified of dogs. We worked with a psychotherapist from Bellevue, actually. She has a private practice, and we worked a long time with one of our teams who had a very, very mild-mannered dog, and acclimated this child into, he wouldn't even go to his friend's house or go to a baseball game if he knew that there was going to be a dog there. So that was one really very, very successful opportunity. In physical therapy, I can show you this actually, and occupational therapy. No, I'm not giving you a treat right now. So, so we carry a second leash with us, and we carry a baby brush. So I'm just going to give you an example. Does anybody want to be my helper? Does anybody want to be my helper? No. Nobody want to be my helper? Okay, so you're
I can't
like,
get up right now because I have a kneecap.
okay, all right, so you can stand up, that's okay. So, all right, so let's pretend, would you like to be a patient?
Sure.
Okay, so you're a patient, and this is for motivation, actually. So, you are the physical therapist, and you want, and the doctor has said that your patient needs to get up and get out of bed because she's had surgery and she needs to start walking around. So, I'm Nancy, and you're going to introduce me to your patient.
Danielle, this is Danielle.
Yes. No, you're just sitting there.
Okay.
All right, so you're just sitting there. So you're going to tell her that, your doctor really wants her to get out of bed, and you really don't want
I don't want to.
Doctor really needs you to get out of bed, Danielle. Please,
No,
come on.
I don't have the energy.
Now introduce me. This is Nancy.
Nancy, this is Nancy.
Hi, Danielle. I'm Nancy, and this is my therapy dog, Melody.
Oh,
Would you like to pet her?
yes.
Okay, you can pet her right back here. Very
Oh,
nice.
she's nice.
Now we understand that you need to get up and move around a little bit, and
Well, that's what the doctor says.
And Melody wants to help you, actually. Would that be okay?
Oh, okay.
So I'm going to take my second leash, and I'm going to put it on Melody's leash here, okay? And so help her get up. And she's got her IV pole here, okay?
Don't
So,
forget that.
all right, so Melody's, wait here, Mel. I'll put this here for a second. All right, so you're going to hold on to this. Okay, and I've got the main leash. We are never allowed to take our hand off of our leash because that's our liability insurance. So get on the other side of her and tell her we're just gonna walk over there and back. Okay, no, let's go. Very good. Very good. Like the puppy. Yeah, let's walk around here.
She's sweet.
Very nice. Pay attention, Melody. Come on, keep going. All right, we're gonna take her back to her with the cat. Have you had enough for now?
Yes, I'm
Okay,
exhausted.
so we're gonna put her back in the bed.
Go back.
Thank you. Very
Wasn't that
nice.
bad, right, Danielle?
No, I want to always walk with the little dog.
So this is something that's very quite motivational. Okay, so I'm gonna come over here also, and I'm going to sit next to you. May I sit next to you? I'm always going to ask.
Yeah.
Hi, do you like dogs?
Yeah.
Okay, so this is a baby brush that we do. All right, so she's had some surgery on her arm and she needs to start using range of motion. Okay, so Melody's gonna lay down here. All right, so you're going to introduce us again.
And this is Nancy.
Natalie.
Mavin.
Hi, Natalie.
Hi.
This is Melody. Would you like to pet her? She loves to be pet right back here. How's she feel to you? Oh, look at you using her arm already. It's a miracle.
Miracles happen every day.
All right, so it's this arm that's affected, right? Okay. So we're gonna give this baby brush to you, and you're going to document the progress your patient is having by brushing Melody.
By writing it down, right?
And you're writing it down, you're documenting it, you're a professional, and there's a goal. And the goal is how she's going to be doing every week. Okay, so go ahead, you're having a hard time doing it, so I'm gonna bring Melody over here a little bit to you. Okay? So this is also a very rhythmic thing to do. It's very relaxing. Kids love to do this. They love to brush the dog's hair.
Good job.
How's she doing?
Doing a great job now.
Look at that.
He agrees too. He's like, stop writing. He's like, stop writing. No more writing.
Is she progressing from last week?
She's doing fantastic.
All right, very nice. All right, so let's thank our participants. Thank you very much. Okay, very good. So this is something that we always have in our bags now. Maybe some dogs don't like to be brushed, so you're not going to do that. So it also can be a way to bridge communication gaps with a healthcare provider. So who's a healthcare provider in here? Is there people that work here? Who works here? None of you work here?
I work here.
You work for Share? Okay. So come here and let's talk here. May she talk with you for right now?
Yes.
Does she talk to you? Okay, so you sit next to her right now. All right. So tell her that someone's coming to visit with a therapy dog.
Somebody's coming today to visit with a therapy dog.
And here we are. Hi, I'm Nancy. This is my therapy dog, Melody. Do you like dogs?
Oh, yes.
Would you like to pet her?
Definitely.
No, stay right there. Yes. So may I sit down over here?
Yes.
Okay. So perhaps you're not feeling so great, and this is your healthcare provider, okay? Or not provider, but your healthcare, what's the word I want? Caregiver or representative, all right? So this is a way to help engage you to start talking about your feelings. So, you might say, well, how does Melody make you feel? So you start talking to her, and so she's gonna, actually, yes, let's change seats, actually. Do you mind if I sit next to you? Okay. All right. Let me take this off. Okay, so you're going to, now, this is going to be an opportunity for you to engage in conversation.
So how does Melody make you feel?
Well, I just met her. But it's very calming to pet her. Would you allow the dog to sit on the patient's lap, or?
Would you mind that? That would be okay. Now, normally I would bring a towel for her to sit on, so I'm going to place her on your lap, but I'm still going to keep my hand on her, okay? All right, so she's going to sit here, Mel. There you go. Okay. So keep asking how she feels now.
Well, I'm concentrating on the dog, so I'm not in my head thinking about things. So
she may want to start sharing things about how she's feeling. Or it might strike an emotion in her where we've had a number of people that just kind of break down because they're so overwhelmed by the feeling. Some people start laughing, some people start remembering. We work with a number of patients with memory impairment. And so they're all of a sudden, they're going to remember that this dog reminds them of their dog growing up. So this is a catalyst for motivation and conversation. All right, thank you very much. You did a very good job. Let's see. Very nice. Okay. So it's also a way to provide emotional support for grief as well. So having a therapy dog around has a multitude of ways of really engaging with people, helping people to forget about their pain or their limitations, and it just diverts them away from their internal anxieties and a lot of other stuff as well. So one of my favorite quotes is from Maya Angelou, and it's, people may not remember what you say, but they'll always remember how you make them feel. So our job is to help people feel good about what they're experiencing. Okay. What's happening? How is he feeling over
She's
there?
doing great.
She's doing
But
great.
what's so wonderful about her is it's almost like a 180. It's not only the comfort she provides, it's the comfort she needs.
Yeah.
Constant affection, you know?
So tell us about olive oil.
So she's so wonderful and timid. I want to get her involved because she's so easy breezy and she's so lovable. But I'm finding through School of Visual Arts that she's, you know, the love that she needs, the affection she constantly needs, makes the individual feel like that, wow, I'm going to provide support for this loving animal, this creature, you know? And so it's like a two-way street. I think it's relaxing, it's calming, and it's
Tell everybody
reassuring.
what breed is olive oil.
Olive is an English bulldog. She's 5 years old. She looks younger, right? A little pup. She's a little chubby. She's on a diet. Prescriptives on D, low cal. She's getting there, you know. Low carbs, exactly. She likes the beach. She does. Loves to go in the sand.
Wow.
Yeah, she watches a lot of TV.
Does she swim at all?
She doesn't swim, unfortunately. I tried, but she won't do it. You know? It would be a great workout for her, you know?
Maybe the paddleboard.
Maybe.
So Margaret, tell us a little bit about Milo.
So Milo's gonna be 2 in August, and we got Milo and his brother, so same age, at the shelter on Long Island. And they're very sweet dogs, they love each other. We also have 3 cats, and they think they're just they just wanna play with the cats. It's very cute. The cats kiss them, and this is actually our first visit. So we just went through the training and everything like that. And hopefully we'll get our other dog through the program as well. So he loves to be a pet me. Rub my stomach, whatever. So it's fun to be here.
So Beth, you have a pretty long history.
I
Tell
have
us
a long-
about you and April.
Well, I'm very old. I started when they first started the program back in the 1900s. No, 1995 was my first dog, which was a long-haired Chihuahua, and she was only lived till 7, but she was a great little therapy dog, and at that time you could only visit nursing homes. You couldn't go to hospitals, or you couldn't do any of this. And she was very good, and then when she passed on, I got a toy poodle, a little bit smaller, lighter, I should say, than this one. And she worked for about 14 years. And then we started the hospital and different colleges, and she loved it. I mean, she knew. And now with this one, she knows if I put that vest on, she knows she's gonna go visit. What? She left. She left. It's okay. She'll be back. It's okay. It's okay. She'll. She had to go to a meeting. Okay. sit down and stay, relax. But we do there's school of visual arts together a lot, and we do all of their,
Why do you go to colleges?
well, the kids are taking, it's usually during exam time, during finals and midterms, and you really can see the difference when the kids walk in. We had 100 students the other day, from high schools all over the world. And they're only here for 3 weeks, but you could tell the difference. They were excited about the dogs, but they were also starting this new program in an art school. So they were a little hesitant. But when we visit the students, I mean, you can just, the shoulders go down, the smile goes up, and it's just, oh, I want to take the dog with me. Can she take the exam with me? Can I take her to the dorm? Can I take her?
A couple of students were struggling. I had heard that. It's very competitive, and they came here from Florida and other places, and they were really nervous and having a tough time. And one girl connected with her so beautifully.
There's a
And
girl from Russia.
yeah,
I had from Argentina, from Chile.
Yeah.
I mean, it was from all over the world. The one from Argentina was so happy, and I kept saying, and it was a very, very hot, humid night, and excuse me. And the students there was a whole class from a high school in Miami, and there were 5 girls sitting in front of me, and I said, don't you mind this heat, this humidity? And they said, what humidity? I said, you gotta be crazy. I am here schwitzing. I'm all wet, and you're saying there's no humidity? Oh no, this is nothing. This is cool. So I said, oh, I'm still not moving to Miami. But it's a lot of fun. I get a lot of satisfaction when I go back to the same colleges for midterms and then for finals, and I see a lot of the same students sign up to come and see the dogs. Oh, there's April, there's this one, there's that one. And you just see it in their whole demeanor, how much they enjoy and it's only for like 3-4 minutes that we get, because sometimes we had 100 students the other night. There were over 100. So we only had a couple minutes with each group of 4 or 5 students. And I said, oh, go to the end of the line and you can come back. Well, there was no end of the line. It just kept going. There was by the time the hour was up, we had a few stragglers, and that was it. There was no go to the end of the line. There were too many. But it was very successful.
Where else do you volunteer?
Well, I go to the hospital. I do the cancer center.
What hospital?
I do Beth Israel.
What do you do there?
I do a floor of pre-op, post-op, adults. And the nurses need it more than some of the patients. Patients couldn't care less, but I still visit the patients. Still sit. Is that her?
yeah.
She's telling you what we're doing. And we also do the Mount Sinai Cancer Center. It's an outpatient, and the staff really loves
And the
having her.
patients that come there, what are they there for?
They're there for chemo, they're doing radiation, they're doing all kinds of tests and all kinds of things, and they just love having the dogs. I mean, their eyes light up, and here they have this needle in their arm, and they're just so thankful to see and pet a dog. And the nurses just relax, it's a wonderful feeling to, over the years that I've been doing this, I can't get over the feeling, the self-satisfaction I get from her being so loved by so many people that sometimes only get to see her for maybe 5 minutes in their lifetime, because the patients come and go. I mean, the nurses, all know her, and more pictures of her than I do, that I will ever have. Is somebody coming in? Is somebody out there?
I think she's.
Oh, yeah, Milo.
Where else do you go from the library?
Well, I also do the read program at a local library, which is a lot of fun.
April.
And I do all the colleges every time Nancy calls. We also did a student film at Pratt College. One of the students asked if she could be in his film for, I guess, his final. So she did first acting gig.
So there's,
But she did, she got paid, she got a big box of Cheerios.
there is something for everybody in our program. We even have a program for people without animals in their lives that want to volunteer with us. Then we always need an extra pair of hands at helping in the classes, the evaluations. As I said, we have over 153 therapy dog teams in our organization, and everyone finds something really special that they enjoy doing. So, do you have any questions about what we're doing, or anything that?
About our dogs, or about getting a dog?
How do you go about getting a dog, a therapy dog?
Well, you get a dog that's your pet. Your dog is your pet, and you're going to see that it has, it's a well temperament. It's never been aggressive or bitten another person or a dog or an animal. So that's how a therapy dog, you get a dog that you have as a pet first. And then you train the dog to be a therapy dog by coming to classes and going through the education program. But these are all our dogs that are pets that we saw had a wonderful disposition, and that they enjoy being with people. They're social. They're good listeners. We train for safety. Number one, that's the biggest concern we have. Is our dog safe? Because in a hospital, you never know when there's going to be something on the floor. In a nursing home, somebody has a pill in their hand and doesn't know. You know, we just always have to be super vigilant, and minding our dogs is our first priority. Making sure that they're safe above anything else, that we are advocates for our dogs. That's our first and most important thing that we need to do. So to answer your question, do you have an animal in your life?
I have two cats.
Mm-hmm.
They're like sisters.
Okay.
They do everything together.
Mhm.
They're very loving to each other. And I had a dog. We were very close. You know, when I had breast cancer, this is like the third time. And when I had breast cancer before, I remember I couldn't get up because of the chemo. I used to be so weak. And there was things that he did that I didn't teach him to do. I had a Rottweiler. He was 150 pounds solid muscle. And I remember one day I wanted to go upstairs to the bathroom, and I just was petting him, and then I held onto the collar, and it's like he knew that I wanted to get up, and he walked backwards like 3 times. That was enough to pull me up. Then, so it was like a routine. He knew when I had to go, and he laid behind. I made by the bathroom door until I came out. You know, but it was like 15 steps to get to the bathroom, and I take a step, he take a step, and wait. You know, very patient. You know, and I didn't teach him to do these things, but he did.
That's amazing. Thank you for sharing that story.
It
That
was
is
like my
amazing.
child. Yeah.
They know,
Yeah.
they know when you're sick. When I came out of the hospital, my dog was right there next to me, knew that I was in pain, and I had been gone for like 10 days. When I came home, immediately got into the bed, did not go on the side where I had the surgery, but went on the other side. No, knew where I hurt the most. Never, and just, they know. You see when you take them to the hospital and you visit one of the patients, and I hold her over the bed, you know, do you want to pet her? And you can just see the shoulders go down, smile on their face, You know, you can walk into a room and they're just screaming and yelling, and the minute the dog goes in, everything stops. It's a wonderful feeling to see the change
I
in the
never felt
patient.
alone when he was there with me. As soon as I would come back from chemo, he would kiss that hand and that side,
Make it will,
and look, knew that I was sick.
yeah.
He passed away, and I thought about getting another dog. How long has it been?
15 years.
Yeah, I dreamed.
What about one of your cats? Have it, a therapy cat?
Close. Yes, I'm close to Sade.
Casey.
Last year I was in the nursing home for a year. I had problems with my leg. They did 6 operations. They took out the kneecap. I don't have a kneecap in this knee now. But I got along so well with my 2 cats. And when I came back, it was, Sade, she's really beautiful. And the other one was Tabby. She didn't want to have anything to do with me. If I give her food, she will not eat her food unless my son is there. She go to the other bowl. It's like, I said, wow, you think I'm gonna poison me?
She'll eat Casey's food. She's like, well, she's not gonna poison Casey, so eat her food.
Yeah, so it's like Casey leaves her a little leftover and I notice that she's getting smaller because of that. And then Casey would go back and eat her food also. I'd have to try to stop it. But, she doesn't like me. She runs. If she see, if you leave with the cane, and the cane now I'm using in the house, she see me coming towards her, she runs. She'll run under the table. She know I can't get under the table, so she'll be there watching me. And I really feel bad about it, but there's, people say, oh, she'll get over it. I've been home a year now.
Give her time.
Yeah. But Kate, I mean,